The College of Allied Health Sciences holds a unique place in UC's Academic Health Center, educating the healthcare providers who will care for patients at every step of their healthcare journey. Our alumni work throughout the healthcare system, providing inpatient care, working behind the scenes in medical labs and administration, and working directly with patients to manage their care in the community or at home. We educate students at every level of higher education, providing them with advanced knowledge of the best practices in their field. Our curriculum keeps them focused and challenged. The college holds an impressive 87% retention rate for first-year students. Through classroom education, research, and hands-on experience, we educate students to provide quality, patient-centered healthcare in a changing world. And we start that process from day one.
Service learning sets the stage for them to give them some experience about working with others and to work on their communication skills, and also to give them the idea of commitment and to understand what it's like to give back to others.
I've learned a lot from my service, just how to communicate with others and just be empathetic. And I feel like I've become an advocate for the people I've served abroad and, minorities and women, and I'm able to become an advocate for my patients, hopefully someday, through the skills I've learned.
After their first year, students engage in experiential learning as part of their major. Through off-campus internships, they immerse themselves in the day-to-day realities of their profession. In the School of Social Work, both undergraduate and graduate students spend at least 2 semesters in required field placements, where they learn the role of a professional social worker and work directly with clients.
It was really empowering to know that I was a valued member of the agency, they valued my service, and really to see how my involvement impacted those students and how I was able to connect with them, and vice versa. They've helped me learn so much, so it's really been a great experience.
And each year, students travel across the globe to serve and practice in communities where allied health services are not available or not yet developed. In trips to Nicaragua, Jamaica, and even as close to home as rural Kentucky, students screen young children for language development, engage with high-risk teams about self-esteem, and fit Appalachian adults with hearing aids.
While we were there practicing, we were able to assess the children for their speech and language skills, and it made me appreciate how much we do have in the U.S. as far as specialty programs, speech pathology, occupational therapy, and PT here. We have an abundance of those specialty programs here. So we're really lucky to have that access, whereas in Jamaica they don't have that.
In their course of study, students learn the process of scientific research as they push the boundaries of knowledge with our outstanding faculty. One of those research projects changed patient care at University of Cincinnati Medical Center. Under the guidance of Nutritional Sciences Chair Grace Valsiglia, graduate students working with the hospital's Diabetes Now team found problems with patients' traditional bedtime snack. They found that the interaction between the snack, patients' insulin therapy, and the timing of each caused diabetic patients to wake up the next morning with high blood sugar. In a multidisciplinary team led by Rehabilitation Sciences Assistant Professor Carrie Dunning, researchers are studying how high-intensity interval training can rehabilitate stroke patients.
It's small bursts of intense activity, and it's been shown in athletes and people with heart disease that it increases the cardiovascular conditioning. And so we're hoping that it would also work with people with stroke.
And just south of the river, faculty and student researchers with Pete Shifley's Fetch Lab are partnering with Newport Aquarium biologists to study the communication of animals as varied as otters, seahorses, and shark rays. Our own communication with students is changing as the new digital age has led to a revolution in higher education. Through distance learning, more students than ever before have the opportunity to pursue life-changing degrees. At Allied Health, we're at the forefront of that paradigm shift. We recognize that our future is in reaching students at all ages and stages of life. Currently, a full third of our student body join us from across the country in our rapidly growing distance learning programs. They span the fields of healthcare administration and information management, medical laboratory sciences, speech pathology, and respiratory care.
The students see this as a way to move up the ladder, gain greater experience, and be able to contribute more at their workplace.
As our graduates go on to exciting careers in the health professions, the college continues to grow as well. We're extending our reach as a global institution by helping to develop curriculum at schools in Saudi Arabia. We're developing new programs in occupational therapy and the rapidly changing world of electronic medical records. And we're reaching out to a younger generation right here in Cincinnati to show how exciting science and healthcare can be. It's all part of our mission and our responsibility to improve the quality of life for people everywhere by discovering, teaching, and providing excellent and transformative health care. Together, we're composing a better world, at home, in our community, and abroad.